Good evening, friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you're watching Dr. KK's Med Talks, Pharma Talks with Dr. Sanjay Kalra. ये हमारे नॉन स्टॉप शो का 884वां 884th episode है. Now, Pharma Talks is a special series where we invite esteemed guests from the pharma industry and from related fields. We converse with them and we learn, we gain their insights. Let's talk about today's theme. Today's theme is medical writing, and it's a rewarding profession. Now, let's look at some hard-hitting stats. With the constant advancement and innovation in medicine and healthcare, obviously, there's a greater need to communicate our research findings. There's a greater need to speak about new products, novel devices, special services. And that is why the role of communicators, medical writers, is growing. The size of the global medical writing market is supposed to grow from $3.15 billion in 2022 to $7.95 billion by 2032. This is a CAGR, or compound annual growth rate, of 9.7%, much more than what any investment will give you. Now, if you divide the world into different regions, Asia Pacific region is expected to experience the most significant growth in the medical writing market. Medical writing plays a crucial role in fostering effective communication between pharma companies, device companies, doctors, healthcare professionals, and patients as well. So it is a very rapidly expanding landscape, and medical writers are the ones who help us engage with each other. And patients who engage with educational content from pharma companies actually exhibit higher adherence to therapy and have a better experience and finally have better outcomes. So now let's see our specific topic, that is medical writing. And let me introduce our guest. A warm welcome to Dr. Rajesh Kher.
Hi, Dr. Sanjay.
Warm welcome, sir. Welcome to the show. To introduce you to everyone who's listening, Dr. Kher is a highly accomplished professional serving as Director of Business Operations in the Regulatory Writing Department at Janssen. Director of Business Operations means बड़े सारे operation होते होंगे, Dr. Rajesh.
Not like what they do in AIMS and other places. So both
Not
simple.
Not like the surgical operations and not like surgical strikes, but there are lots of other things in business.
Absolutely.
Dr. Kher, and now I'm thinking of Dr. Kher wielding that scalpel or other things with which you do surgical strikes these days. So, but a very distinguished career in the pharma industry and a wealth of expertise in regulatory affairs, scientific communications. This is what Dr. Rajesh brings to the table today. And his exceptional skills, combined with his commitment, combined with the very high standards of regulatory compliance, make him an invaluable asset, not only to his organization, but also to everyone who is listening today. So warm welcome, sir.
Thank you, Dr. Sanjay. This is really overwhelming introduction. So I can say, except for commitment, I wouldn't be really very comfortable with all the platitudes that you provided. So I am really committed to this regulatory medical writing. Definitely. Am I a leader? I really don't know. I hope I'm able to bring something to our young listeners today, and I hope it's useful to them.
All of us, young and even those who have more experience of youth, myself, for example, we all look forward to listening to you. We welcome Swapna Jainji. Madam is a health advocate from Vellore in Tamil Nadu. And the first question is, now writing has changed a lot over the past few centuries. There was a time that people used to write on stones and slabs of mud. Then we used quills. Maybe when you were growing up, you used ink pens, fountain pens. And now things are changing so fast. Now people use their tablets and AI. So the first question is, what made you interested in medical writing? How were you at grammar, at past perfect?
Right. So this is a very interesting question. Like what you said, how did we evolve? I come from Kashmir, and so my remembrance goes back to started writing on wood and using mud and a pencil chiseled out of a pen rather chiseled out of wood. So that's how we started writing, and our elders would say that your handwriting is going to be better with that. You get a better grip and probably in neural hand coordination, brain hand coordination is better. But let's get back to the main question. So why did I start? And so I, like many of us in India, so we start our education pretty early, and we start with English as our medium of instruction. Many of us, and especially in the medical writing community, that's been more the norm. So I did my PhD in endocrinology and was a researcher for a long, long time in nephrology and renal sciences. Uh, then we decided to return to India from the US, and that's what to do next. And that's where we saw that this is a core strength that researchers have, and also writing in either in vernacular or in English. So it comes very naturally to Indians. And I thought that, well, this is easiest because you need to be a scientist when you write for pharma industry. So that's something when I started looking around, how do I fit in pharma industry? There was either go to the labs or start something which is close to science, and also I can use my skill sets, strengths in there. And English definitely was one. Communication is something that's very, very important when you go into medical writing profession. Understanding science again, and then having a good knowledge of biostatistics or statistics per se, that's important. And those were some of the things that came pretty naturally to us while going to school. We are taught statistics and mathematics being a stronghold for a lot of Asians. So it all gelled together, and it seemed to be the right profession for me. And another driver, a big driver, is money. So it pays well. It does pay well, and it also gives us satisfaction. For many of people, especially in India, and I'm not, I'm just saying this, like people who tend to be homemakers, uh, either men or women or any other sex. They can work off work on any medical writing documents with a lot of computing stuff that we have now available. Medical writing is a um, great opportunity to utilize to have work-life balance, a wonderful work-life balance, and not have to spend time on in traveling and other things.
That makes sense. Good evening for you from Natasha Das ji. So, what we hear is that first of all, you need a very confident command over both science and statistics. And secondly, you need to have a good grip over grammar, over language. These are the two things that are required. The advantages are that you can work at your own pace, you can manage the work life balance quite easily. And along with that, the financial or fiduciary benefits are significant. So, it's overall a comfortable sphere for us.
Yep.
Couple
And
of questions
that's what I feel. That's what I feel.
couple of questions coming your way. First of all, about language. So, I am fond of writing. I enjoy writing in an amateurish kind of way. But if someone were to ask me, like let's say a particular play of Shakespeare, maybe Hamlet, second act, fourth scene, I don't remember what he said or what the character said. And also, I don't remember the difference between past perfect and present continuous tenses. Am I still fit to enter the medical writing
Yeah,
industry?
I wouldn't really worry about that. So we pay a lot of stress on grammar, but I don't think that is really the right way right now. How we go about it? It's, does it make sense? Is my audience able to really understand it? So you see, grammar varies from region to region. It varies in US, the grammar, the way they look at English. is quite different. It's Indian English is different English, Queen's English is different English. There are variations. And if you look at pharma companies, they're globally situated, and our writers are all across. Initially, it makes things little bit challenging and not a whole lot because the writing styles are different. But essentially, in medical writing, you take publications or you take regulatory writing. It is essentially, are we able to communicate our message correctly? Right now, if we go to languages like Hindi or Chinese or Japanese and all, they write in their own ways, and the grammar is different. And we have translation tools. It doesn't do a perfect job, but we still understand. And that's where I think, as a writer, I would pay more stress. Am I able to communicate my message correctly? Is my audience able to understand that in the right way?
Okay, so we are learning more. So even if I am not very confident of my grammar, and maybe I was not very good at unseen comprehension in school, I can still think of picking up a career in medical writing.
Yeah, get trained. So I don't mean you need to be really bad at grammar. I mean, like in India, we know that we always our so what I have seen in industry here is the way we translate, the way we think in Hindi, we translate it in English as well. So for example, it's say मैं आपसे मिलने आया था, right? I had come to visit you. So in English, I would rather say I came to visit you.
Came to see you.
Right. So but in Hindi we would understand what he is like. I see those emails all the time coming, I was doing this, while as the person is writing presently, and that happens, but we do understand. We don't penalize that person so long as the message is clear, right? And then there's no reason for someone not to improve on the job. Doesn't make that person a bad writer, probably needs to improve, which happens probably in your profession as well. As a starting surgeon, probably you may not be the best, but as you gain experience, you watch, you execute stuff, you are going to become better and better. And it's the same thing for medical writing as well. You need to have good command about your communication in whichever way it is, be able to communicate well, be able to think well, and have the basic skill sets that are required. I
So
hope that makes some sense.
that makes a lot of sense. Anita Dadlani ji, wishing you a good evening and blessings for
Thank
you,
you.
sir, from Dr. N.S. Sharda. Sir is one of our senior most physicians located in Ahmedabad.
Thank
He
you.
sends his blessings.
Thank you, sir.
And also Dr. Talha, who is a psychiatrist from Roorkee, saying hello
Thanks.
to you. So, what Dr. Rajesh is saying, he has created a hierarchy for us, a pyramid, in three things. The first is education, the second is training, and the third is experience. Now, if you speak in Urdu language, this sounds very alliterative actually. So, talim, tarbiyat, or tajurba. Talim, tarbiyat, and tajurba, which is education, training, practical training, and experience. Now, if you were speaking in Urdu, a fourth ta would be added, and that is so talim, tarbiyat, tajurba, and tallukat. Are tallukat or are connections important in the medical writing industry?
To get your first job, probably yes. As much as for any other job that you're looking in life sciences industry, and maybe others, I don't really know much, but it really isn't. I wouldn't give out a message that those who don't have those, they can't break into industry. So that may not be true. So how does it help us? That helps us that our resume gets to the right person, right? And beyond that, it doesn't help. You have to go through the whole gamut of interviews. You have to really take the test, and you have to convince your interviewers that you are fit for the job, and that's bottom line. I think our connections help to groom you, help to mentor you, help to tell you how to make your resume. which is important because the people to whom this resume may land up for the first time, they may not understand everything, but they look at keywords, and the connections will be able to tell you how these keywords are looked at by our HR or by our people who triage our resumes. I'm trying to make it very simple, saying that they are important, but they are not they're not everything.
End of it
So,
all. Yes, I would fully agree with you. And the best part is, sir, we have senior colleagues logged in today, both with more experience of youth than you and I. Dr. VK Goyal says we are seniors. I am 76 years young now. I am not an expert in computer science, but thanks for choosing this topic. So maybe in a few minutes we'll come to the importance of knowing how to write on a laptop. Dr. N.S. Sharda sir shares another example of alliteration, this time in English, and he says it's education, experience, and efficiency which matters most. And
absolutely.
yeah, Dr. Sharda sir, thank you. I mean, we couldn't have put it better. I will agree with what Dr. Kher says. It's a meritocracy finally. So finally, it is merit which is going to get you your job, and certainly it is merit results which are going to get you to keep your job and to grow in that.
Absolutely. Yeah,
We
I just wanted to add. I just sorry to interrupt. I just wanted to add. So why do we write? Why is it important? It's important because we are into drug development, right? So I'm sticking to medical writing. We are into drug development, or we are into patient healthcare, right? So patient is at the center of everything that we do day in and day out. So it's not just about doing our job and getting a salary at the end of the month. It's about doing the job rightfully, doing it correctly, because the patient can be I, the patient can be my neighbor, my parents, my relatives, right? So we really have to be good at what we do. We should be able to do it correctly, ethically. Ethically is very, very important. And it's not just about like, okay, this is a job I need to complete. This is a 9 to 5 job. Yeah, we complete it in 9 to 5, but it's not something that I have to put ticks and I did it. It is to go back, that I am doing it correctly. I'm interpreting the things that I have written correctly, or I'm interpreting the data that I'm going to send across to a varied audience, which could be a general person, and some people call them layperson. So it could be our scientists, it could be our physicians, it could be patients, anyone. So it's really important. Meritocracy, definitely, I agree with that, and that would keep us in the job.
I'm sure other colleagues who have logged in. Dr. Vipin Mandula is civil surgeon from Kangra in Himachal, and Dr. Rameshpal Singh Pawar sir is a pediatrician, 70 plus year young pediatrician from Saharanpur in UP, and now in Atlanta in the US. So he says a good morning to you, sir.
Good
I'm sure
morning,
everyone
sir.
will agree. Yeah, finally, it is merit which will help you succeed in life, and merit will supersede each and every other aspect of things that you bring. But let's come back to Urdu. So we were talking of talim and then tarbiyat and tujurba. So that is fine. That is education, efficiency, practical efficiency and experience, the way Dr. Sharda sir put it in English. Then we talked of talukat. So that has gone out. The fifth would be tehzeeb. What does the word tehzeeb mean to you, Dr. Kher? And what kind of tehzeeb should a medical writer internalize? What kind of a tehzeeb should a medical writer live?
I think it's tough question and simple as well. So for me, I have not had a lot of people whom I have trained directly. There have been very few, three or four folks who I have trained. And what I would tell them is start with ethics in mind. And if you start ethically, so you get the tamiz, tahzeeb, right? It's if we mean tehzeeb by how do we deal with our seniors or juniors, so I'll come to that as well. But my tehzeeb, the definition of tehzeeb starts with ethics first. We have to be ethical in what we do. If we don't understand something, we really should be honest enough to say, oh, we do not. And that goes back to, because we are into drug development, we are into healthcare, patient care, and all. So then, if we talk about how do we deal with our community, that's important. Again, with the community, the immediate community is going to be your colleagues. You treat them with utmost honesty, with utmost respect, because respect will beget respect. And without anything to do with color, caste, creed, your sex, so your community, whether you're a Western, you're an Indian, it really shouldn't matter. It should be respect should be given. Respect should be given irrespective of what, and probably more so in medical writing, probably in everything, but in medical writing, let me stick to that. It's really really important because if you start thinking that way, you will be able to interpret your data in a very very rightful manner, whether it is about any sex, because that matters. Genetics matter, genes matter in when we interpret our data as well. So I don't know whether I went off target or that's what you were expecting.
You're bang on target, because what happens is, we'll come to a comment from Natasha Dasji. She's a successful medical writer. But let me explain why we asked this question. The reason is that both Dr. Kher and I, we are endocrinologists. तो हमारा जो सब्जेक्ट है वो हार्मोन्स के साथ डील करता है. हार्मोन्स में एक लफ्ज है, एक शब्द है एंडोक्राइन. एंडोक्राइन मतलब आपकी बॉडी में एक ग्रंथि ने, अ पर्टिकुलर ग्लैंड इन योर बॉडी, वो एक केमिकल निकालती है जो बहुत दूर जाके असर करता है. सो फॉर एग्जांपल, द थायराइड ग्लैंड इज इन द नेक, सो इट विल ब्रिंग आउट थायराइड हार्मोन फ्रॉम द नेक. मगर वो जो थायराइड हार्मोन है वो ब्रेन पे भी एक्ट करेगा, हार्ट पे भी, पैरों पे भी, हड्डियों पे. सो इट विल एक्ट थ्रू आउट द बॉडी, फार अवे फ्रॉम वेयर इट वाज प्रोड्यूस्ड. एक और हमारा शब्द या लफ्ज है, दैट इज पैराक्राइन. पैराक्राइन मीन्स दैट a hormone is secreted, but it acts only upon the cell right next to the gland. So supposing, for example, a hormone is secreted from a particular cell in my skin, it will act only on the surrounding skin. It will not act on the brain or on the liver. So P for paracrine, P for endocrine. Is this correct, Dr. Kher? कि जो physician है, the physician is also very responsible, but at best, the physician has a paracrine effect. I am able to help one or two or five or 100 patients who are situated next to me, who are contiguous to me. But जो
I
writer है,
I don't
हाँ, चलिए,
agree with that,
let's
and
turn with
that's
the
why I'm
medical writer.
interrupting. That's
Yeah,
why I'm interrupting you, because when you do something, you have a writer next to you who takes your message out, right? And
right.
he sends, either you write yourself, either you put the writer's hat from a surgeon or a physician and you write, right? You're a medical writer then, right?
Yes,
Or you get a professional medical writer like me or Natasha Das, and
so,
we will do it for you, and
yes.
we'll send it
So,
across the world. So your reach is going to be across, even in the books, right? And that's what your students are going to read and all.
and
So
that is
I'll let you
that is
complete.
yeah. So that is exactly what we wanted to say, that as a physician you have only a paracrine effect, but once you get engaged with a writer, with a good writer, then you have an endocrine effect. जो medical writer हैं, she is able to take your message across the globe. And when the message goes across the globe, it has to be a neutral one. We should be passionate about the work that we do. I am passionate about my endocrinology. Dr. Kher, it's so clear. वो तो खुशबू दूर दूर तक आती है कि Dr. Kher is passionate about his work, his medical writing. But when you are writing about science, at that time you should be dispassionate. So you should present the facts. If you are asked to, you present what you think about those facts. But if you are not asked to, you keep your thoughts in your mind and you present the facts as they are. You let the reader understand. And
Very well.
Yeah, like Dr. Kher said, sometimes geography, the fact that I am from India, I may prefer to cite more Indian authors in my writing. Though unfortunately in our country, I have seen that the opposite is true. With colleagues also, they are very happy citing Western authors, but they do not want to cite authors from their own country because there's a more of a competitive spirit. So वो चलो separate matter है. But we have to keep these biases apart. Coming to a
Yeah.
best practice, Natasha ji कहती हैं that the good thing about being a medical writer is that there is continued learning with each project. And if you take it in the spirit of learning, Explore the topic, read, write, review, edit. Then again, read, write, review, edit. Keep on reviewing, keep on editing, and never submit until you're happy. Though, of course, you have to keep deadlines and timelines in mind. Is this right? This concept of continuous learning, is this something that is ingrained into the ethics of medical writing?
Absolutely, and what Natasha said, and Natasha is a very, very senior person, and she's a guide philosopher and a friend that I have in medical writing. She's very well established. So this is a mantra. So, and I would just add one thing. So when you read, write, review, edit, stop, and then let it stay. Come back with a fresh mind. Read, write, review again, and then when you do multiple times, you will see that the end product is going to be fabulous, rather than just and with experience, like what we talked about before, our efficiency will increase, and then we will be able to do a second round of review quicker and the third round of review much faster, and then probably you don't need any other further rounds of reviews and all. But definitely Natasha said something that I would really want to convey this, especially to our Indian writers here, because this in the industry hasn't really gone down very deeply in India. If you compare us with the writers elsewhere, they may be very senior, 15 years, 20 years, they still do it. Sometimes here we see that um, probably due to time pressures, other compulsions, um, people ignore this basic fact, and then the quality does suffer. And very, very good point by Natasha.
Greetings for you from Satendra Singh ji and also Anamika No. And the topic we are discussing today is medical writing as a profession, as a passion also. Dr. Sharda sir has a point, and this is related to my city. So let's talk about the Vedas. So Dr. Sharda says that earlier we lived in a closed thought pattern society. Closed thought means that the Vedas were kept secret. For example, education was kept secret, and teachers would share this knowledge only with their pet pupils. Then we had someone called Rishi Vedvyas, who was born on the Yamuna River and who happened to live and work in Karnal, which is where I work. Ved Vyas means somebody who structures the Vedas. Divides or splits is the word that is used in English, but actually what it means is somebody who structured the Vedas in such a way that mere mortals like Dr. Rajesh and I could understand. So that is Ved Vyas. Uh, Dr. Rajesh, does the medical writer take on the same responsibility of being a Ved Vyas for whatever topic he or she is writing on at a particular point of time?
Yeah, so you mean distributing the
Knowledge.
teachings and
Yeah.
all.
And
Yeah,
shifting us from a closed thought pattern to an open
yeah.
thought pattern society.
That's the most important thing to do, and like what I mentioned before as well, our audience is wide, right? So we do not, yeah, of course we do some individuals, right? We do see some individuals who really keep things to themselves, and then kind of, if they have a submission, they take it as just as a job. So they take away the passion, they take away the teaching aspects. There are people, so right or wrong, I really won't be able to comment on that, but essentially most of us as writers, we know that our audience is going to be wide. It's not just going to be the regulator, but even if it's a regulator, then it's going to go beyond. Somebody else may publish what we wrote as a regulatory, or vice versa. So it has to go out. And then teaching part of it, the art of writing, the art of um, creating a manuscript, that part, if we do not teach our other writers, our junior writers, if we do not, that's from the profession point of view, if we do not do that, what we are withholding, they're going to withhold the same thing from others. They're not going to learn the best practices. And then tomorrow, if the need comes, I'm old and I'm not writing, I'm not reading so much, but I need something that's out there. But I've never done that during my years. I'm not taught the same thing to the other. And that person may not have really learn the best practices, and they're going to give me suboptimal level of information. So it's very important to think wide, to think globally, and kind of whatever we know, let's give it out to the society, keeping society in our mind. And that may be a writer, that may be a physician, that may be someone else, is very important. I agree with uh,
Dr.
that's
Sharma.
the way we should, yeah.
And if you're confident in what you do and you're secure in yourself, if you have self esteem, self confidence, there's no issue at all. I'll share a best practice. One of our friends, his name is Dr. Deep Datta. He's an endocrinologist in Dwarka in New Delhi. He learned meta analysis with great difficulty. There was no one to teach him. So he was like Eklavya, perhaps, searching for Dronacharya, and then he found multiple E Dronacharyas. He learned the hard way, but now he is giving back to society. He is very happy speaking at conferences, YouTube videos, which teach us how to do a meta-analysis. And the thing is, if you learn how to do a meta-analysis, even if you are in a small clinic, let us say in Karnal or Kurnool, you are able to leapfrog over the people who are there in the big metros or in the big academic institutes where randomized control trials are being done. If you can actually write a good meta-analysis, you give better quality evidence as compared to the RCT authors.
Yeah, and
Uh,
you can apply that in your practice,
you
the
can,
learnings,
yes.
and also you can do that. And because you may come across something that is right now the latest one, or that's being followed by many people, and I may be doing it differently. So I see, okay, let me look at what the majority is doing. So you're doing a meta-analysis and probably apply it in your practice in whichever way you want to do.
I wouldn't be able to speak about other fields, but I can speak with confidence about my chosen field, which is endocrinology, Indian endocrinology, South Asian endocrinology. It's a very happy profession, family like atmosphere, and you find people going out of the way to help each other, to help peers, seniors, juniors. And this concept of sharing is well ingrained in our ethos. The same thing said by Sweer Shahji, who says it's a great interview, and thank you, Dr. Rajesh, for sharing your insights with us.
Thank you.
Sir, how has medical writing evolved over the past few years in India? What changes are you seeing
Yeah,
maybe in the last 10 years?
so I really think that more work is coming over to India now over the last few years, and I wouldn't say that there's a dramatic change in the last 10 years or so um, in terms of the quality of the documents that we send across, but the quantity of work has increased. So the other part, what we are seeing is the variety of work. So when we talk about medical writing, we can divide it into multiple buckets. One is publication writing or scientific writing. There are other aspects about scientific writing which I am not going to go into because it will take an hour or so. And then there's other parts is the regulatory writing, and that's where we write about the drugs in development, or even the drugs that are in market and they go to the regulator, like our own drug controller, or it goes to the regulatory authorities, FDA, EMEA around the world. So previously what we saw in the regulatory field is we were getting low complexity work, and with low complexity work, that means like the protocol amendments, or they mean the phase one CSR, the early CSRs and all. So has that changed? Not much, to the level where our writers, it's not keeping pace with the competence of our writers. There could be multi factors around that. In publication, yes, we are growing pretty well because there our writers are able to really show their work. They are able to tell, like they take charge of the whole publication, our writers in India. And like what I said, our communication is good, our understanding of science is good, our statistics knowledge is good. So they're able to help the authors, that is the physician, that's the other team members. We are not authors if we are writing for someone, we are just writers. And that's a different perspective altogether. But we're trying to bring together because we understand the message that our authors want to give, and we streamline that, we create it in a way the messaging becomes easier and it's really correct. We're not over interpreting or we're not under interpreting anything. So that aspect has grown by leaps and bounds. So a lot of publication, manuscripts, and other stuff that is associated with publications that happens right in India. That's grown in the last 5 6 years dramatically. In regulatory, the numbers have grown, but not the complexity of the documents. We still aren't doing submission, lot of submission documents. We are not doing phase 3 protocols where the designs are developed or our writers contribute to development of the designs and stuff like that.
Natasha ji says that in India, she sees more physicians outsourcing manuscript writing today than they did 1 to 2 decades ago. Yes, I do agree with you, Natasha. That's true. Earlier, they were not sure. I was also not sure whether it's okay to hire a professional. And it took us a long time to understand the difference between professional medical writing and ghost writing. That is also part of ethics. Dr. Sharda sir says we were speaking of closed thought and open thought, but what he appreciates in you, sir, is your open heart, the way you are discussing. So, would you like to talk about this? What is ghostwriting? Why is that not
Very
good?
interesting.
Hmm.
Yeah. So in ghostwriting, someone is doing your work, right? And you're claiming that you have done that, and that's unethical. In when you do, and I'm not the best person to answer this. I expect Natasha to be putting in a comment or so over there. And in terms of a professional medical writer, so when a publication, they write a publication, so it is the duty of the authors to put in a disclaimer or to put in an acknowledgement. Their name should be acknowledged that they wrote it. What that means is they're not responsible for the data, they're not responsible for interpreting the data, which means the person who did that study is responsible. It is that person's driven data, it's that person's interpretation which the world is going to see, right? In a ghost, it's probably someone else writing, not being acknowledged, not nobody knows where that person is coming, and it's an invisible person. So did Natasha put in a comment or not?
Waiting for that. But she says that another good thing is that more training options are available for newcomers. And here also, I would agree, Natasha. I took over as editor of Indian Journal of Endocrinology Metabolism in December 2010. And there was no training available whatsoever. How to be an editor, how to be a reviewer, how to be an author. And we learned the hard way. Now it is much easier for people who are at the helm. And things have improved also because of that. Things have become
Absolutely.
streamlined, more systematic.
Yeah. Yeah, there are
So
many professionals. There are many professionals who provide a lot of trainings these days, and very well established professionals who do that. And then there are a lot of conferences where you get pre-conference workshops, and they also do that all the year round. So a lot of good professionals come in and they take those trainings, and they sometimes even collaborate with institutions of repute like yours, AIMS and other pharmacy colleges, and they provide those trainings over there. And if it's done by the organizations, then I don't think there is a lot of, it's not done for profit.
in 2011-12, I think Indian Journal of Endocrinology Metabolism did conduct medical writing workshops across the country, and they were considered very big, very unique things. But now, virtually every conference in diabetes and endocrinology will have either they will have a dedicated conference once a year, or they will have a separate hall for training. And Natasha points out that in ghost writing, the writer remains a ghost; he or she is not seen. But professional
Exactly.
medical writers are acknowledged, therefore they are seen. Ghostwriting is unethical, but hiring a medical writer, a professional writer, it is ethical, it is transparent, and it is helpful also. It helps you
Yeah.
move as a doctor from paracrine impact to endocrine impact. You are able to impact lots and lots of people across the world.
Yeah.
Natasha ji speaks about transparency. So her comment is Science has to be transparent. Science writing also has to be transparent. Any good examples, any bad examples, things that we should take care of with regards to
Yeah.
transparency?
So it's a very tricky area to be commenting on that. So I'll keep it very neutral on transparency without going into some difficult areas. So yeah, we always say that we have to be transparent about communicating what we see. So now it depends upon how is it going to affect the IP. So if you're talking about drugs in development, so there may be IP issues because you spend billions and billions of dollars in bringing a drug to the market. Now, if you do not hold those, and of course, it has to be done ethically. It shouldn't be like you have a drug today and it can save somebody. So there are those laws. The regulators have come up with those laws where you can do those kinds of, you can provide drugs in development to single patients or for rare diseases and all. But I mean to say, should we be publishing at phase one? Should we be publishing at early phases? Yes and no. No, because if we don't look at the ecosystem, things will not work. Because if you start publishing without going for the IP, then you may not be able to recoup the cost that go into bringing a drug to the market. So that's one side. Then, if we are talking about the research that we do, where IP is not really at stake, of course, we must publish very transparently what we see, even the negative results. We must publish those. We shouldn't withhold those. That's very important because that may save somebody's life. And that may even propel a negative result, may propel a new research in some different way. So it's very important to be transparent. And there are so, but within the limits to maintain the ecosystem that we are in, and so that um, this is sustainable. Drug development stays sustainable. Healthcare remains sustainable. So within those limits, so we must be transparent.
That's
It
right.
was a
And
tough question. It was a tough
no,
question.
Dr. Das agrees. Yeah, she was writing actually about medical publications, not regulatory writing. But you are right. Confidentiality is important in both, and the reader needs to know who wrote the draft. That is the main thing. So if you've
Absolutely,
taken
yeah.
the help of a medical writer, there's no harm in acknowledging that
There's no
initially.
harm in it.
Yeah, in
Even
my
in the regulatory,
yes,
someone who writes the CSR, that person is not really going to be the author. Like when we outsource work for CSRs, they're paid for that job. So sometimes people get upset. Oh, we wrote it. We are not acknowledged there as an author. No, you're paid for those services. There is a team who is responsible for that data. They analyze that data. They are the ones who really own that, and they're the ones who are authors.
perhaps in a later discussion, maybe not today, we might want to talk about biostatistics and confidentiality, transparency, and ethics regarding that. How much role does the biostatistician have, and how much right does he or she have as an author? But in the meanwhile, there's a thank you from Vijay Sharma Sahab, who says, excellent job and my regards to you. Thank you for
Thank you.
making this topic very simple. Dr. Sharda sir has another piece of advice for us. He says, you write like a sportsman, the way a sportsman plays. You do your best and don't be worried about criticism. The crowd will keep on screaming and shouting, you got one goal extra and you got 5 runs less. But you keep on doing your work as a good writer and don't let criticism bother you. Just be faithful to your ethics.
Exactly, and that's what Mahendra Singh Dhoni says about his cricket, and that makes him a great, great cricketer. He says that follow the process, keep it simple, and things will fall into place.
Natasha, I don't write all that much now. I do write, it is amateur writing, but I'm on the wrong side of 50, so it's not so much. But 10 years ago, 15 years ago, when I used to write and publish, I used to get trolled, and people would say that I have ghost writers. I have employed writers in Canal who are doing the writing for me. No human being can write so much. But the point is, I loved writing. I enjoy, even now I enjoy it. And the other thing is, the people who told me, they never realized that I am unable to type on a laptop. I can use it, I can do things. But if you want me to write original thoughts, then it is with paper and pen. Usually my hands are full of ink at any given point of time in the OPD. And I'm happy writing that way. So I follow what you do: write, review, erase, and then write again. And then when finally things are reasonably okay on paper, then I type it myself or I get it typed. So you will get trolled for whatever you do, and that is also part of life. The difference, Natasha ji points out for the viewers, is that in a regulatory writing, the regulatory writer is part of a team, and the team, that is the CRO, which is a contract research organization, is the writer. It's not a single person. So they're doing regulatory writing for us. While in medical publication writing, whatever we will read in a journal, usually the medical writer is paid, but it's one person or maybe two people writing together. And there it is more individualistic. So
Yeah.
those people are acknowledged. Dr. Sharda sir reminds all young and not so young medical writers that it is practice which makes one perfect. Dr. Rajesh, your experience, your career, is Dr. Sharda sir right?
We're
Dr.
back.
Kher, are you with us? Yeah, you're back.
Yeah, yeah.
So, practice makes perfect. Your opinion on this?
You said practice makes perfect. Yeah, Natasha already mentioned that. We keep on doing that, and you talked about efficiency. So once we do that, but here we do not practice at the cost of sending out the message. We practice first. We practice with our senior. We practice with, but not just when we have to communicate. We go for zero errors. That's what we should strive always for, because we are into healthcare industry, and absolutely we must train ourselves, but not on a live document. We practice on old documents. We practice on what has already been published. How do we handle those, and that kind of a stuff? We have to go take that route. We practice something that's already written and see how did we do on those ones.
Yeah.
But on our own document, we review, and that's also a practice. But eventually we want to create a no error document, because we are in healthcare.
Swapna Janji says that it's been great listening to you. She says, my vocabulary, my grammar is not all that good, but I try to learn every day and try to write. So even if you're writing something for Twitter, if you're writing on LinkedIn, whether it is 50 words, if you're writing a blog on Facebook, anywhere, that is also practice. So do keep on writing, keep on learning again and again. And she says that is the
Yeah,
way to improvement. Dr.
yeah.
Rajesh, when you read something that you wrote yourself, like all by yourself 10, 20 years ago, how do you feel?
Yeah, I haven't written a lot in science, so but I have written lot that is not science. I do write really in some groups and stuff like that. I'm pretty fast at writing, so I do write my thoughts out, and also and they stay sometimes in Facebooks. I was part of a group, and I wrote
I think there's an issue with the connection. While we wait for Dr. Kher to come back, Dr. Shada sir points out that constructive comments are welcome. Dr. Vipin Mandula
somewhat
loves.
the connection goes. Yeah,
Yep, welcome, doctor.
so in those, I think I do pretty well when I read them, and I think, but when I read what I have written in science, I always think that I could have done better. So whether it is when I was a writer in the regulatory arena, so I think I could have done better. Whether it was the grants, some grants, I have not written a whole lot of grants, but There have been grants when I was in academia, so I always thought that I could have done better in those. So yeah, there's always room for improvement. You have to be your own critic, and it's important to become better. And to our viewers, one of our viewers just mentioned about vocabulary. My vocabulary isn't great, all that great, and all, but it doesn't really bother me because I write very simple. I don't write convoluted sentences. So, and I think the message goes out pretty effectively as well.
The word convoluted is nice because there is something called a readability index, fog index. And this
All
is to
right.
all people who are medical writers and medical readers. Try to have short sentences, please, at the most 10 words. And sometimes it's okay to have 20, 30 words per sentence. I also do that. But there are times when you get, I count also as an editor, as a reviewer, 74 words in one sentence. That would be a whole PhD
There's a
thesis.
paragraph. There's a paragraph.
56 words in one in one sentence. So try to sort of shorten them. Uh, Vipin Bandula ji and Sapna Jain ji both love blog writing. So that's nice. The English word that I learned recently, Dr. Vipin, was homodox. 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 That is people who think alike. We think the same way. Natasha points out that there is nothing perfect in medical writing, perfect with the apostrophe open close. So the Rig Veda also says that the truth is one, but the paths to it are many. The truth is one, but the ways of achieving or reaching that truth are many. So a write up can be interpreted differently by different reviewers. And if the author, the chief author, wants his or her personality to flow from that, he may have his own likes and dislikes. Maybe, for example, we said short sentences, or maybe convoluted sentences. So you accept the criticism and change your writing to meet that person's requirements. And
And yeah, you're right for your audience. She's absolutely right. When you're talking about professional writing, you write for your audience. If you're writing for yourself, then you should not even publish it. You should keep it framed on a wall and then read it. And if you are writing in a blog, that's for people, right? That's for yourself, that's for people as well. So even there, you should strive that they should be able to understand, they should be able to appreciate. And as much as possible, we try to modulate the way our audience wants to really read. And for the interpretation of things, and that's if I talk about publications, that's why we always say that when you have to quote, you have to quote a reference. You do not quote a reference from a review. You quote a reference from the original science, original research, because review is the writer's interpretation of someone's research. There can be different ways of interpreting that, and that's also important as a writer, something we really need to understand.
the words to understand are textual and contextual. Textual means it is the text. So let us say it is a particular religious scripture. You can choose whether you want to read it in a textual manner or you want to interpret the context yourself. Was that religious scripture written 1,000 years ago, 1,500 years ago, in which geography of the world? Similarly, if you are writing, let us say, a product monograph or a prescribing information, that is textual. Whatever is there in the text, that is there for the viewer, for the reader, and there are no ifs and buts about it. So, if the prescribing information of a particular drug says this is not to be given in type 1 diabetes, it is not to be given in type 1 diabetes. However, if you're writing a blog or maybe a review, a narrative review, then that is contextual. You can bring your context into it. So I might have to say, yes, such and such an insulins have such and such a prescribing information. But in my context, these are the kind of patients that I see, and these are the kind of changes that may be made. So that is contextual. Dr. Rajesh, the same thing holds true for our talk today. It's been 1 hour now, and we are in conversation with each other. Has it been a textual conversation or a contextual one?
It's, I would say it's both, more contextual and than textual. We did put in the textual references as well, and I hope our young writers who are professional writers, they do the textual part if they are professional writers who are paid for their services. And for those who aren't, and it's going to be more contextual. So
Question for you, last question we'll take before we close for the day. You may wish to highlight on plain language beyond the readability of text.
Yeah. So absolutely, and that's a thing that we hear these days, and now it's been few years. So we talk about plain language summaries. We talk about putting highly complex documents that have a lot of scientific jargon into something that is understood by the person, common man, who doesn't need to put in a scientific hat, or isn't hasn't learned science, or is general public. So I wouldn't use the word lay public, but general public. Let's stick to that, and they should be able to understand. So if they don't understand diabetes, and we can tell them in Hindi that it is madhumeh, so let our plain language summary be having this word madhumeh, so that they understand what we are talking about. As if they don't understand HbA1c, is there a way we can tell them what HbA1c is, right? And that's what the plain language summary actually is, and that's where the world is going for, conveying their information to the public at large.
This brings the paracrine and endocrine aspects of the medical profession together, because even as a doctor, if you want to be successful, you have to be able to communicate in the language, in the dialect, in the manner that your patient is fluent in, that your patient prefers. So you should be able to explain complex biomedical issues in simple words so that your patient understands. Otherwise, the patient is not going to stick to you. The patient may stick to you for some time, but that is because there is no alternative. The moment the patient finds a more friendly alternative, he or she is going to move. That you can take for granted. There may be nothing else in the world that you can take for granted, but this you can be assured of. Similarly, as a medical writer, if you are able to actually believe that you are a Ved Vyas, your work is to simplify things. You're able to think like a Ved Vyas and then write like a Ved Vyas. Whenever you are writing, whatever your work is, of course, keep your audience in mind, whether it is regulators or general public or doctors. Then the battle is not half won; it is fully won. You just have to believe and think and work like a Ved Vyas, and then you see how things flow. We are grateful, Natasha ji says, that you've brought this topic to a wider audience. So thank you so much for being with us. Dr. Rajesh, we
Thank
have Pratik and Faraz backstage with us. Could you please show a certificate of appreciation for Dr. Kher?
Thank you so much. It was really a privilege to be talking to my colleagues, to be talking to my peers, to be talking to my seniors. Some of them may have been my teachers, are still teachers, being out there as seniors, and also my fellow colleagues and people who are just going to take medical writing as their profession. Thank you so much. It was a privilege, Dr. Sanjay, to be talking to you. You made it so easy. You made really very easy, very made me comfortable. You didn't ask me really tough questions. I was very nervous.
We've learned so much from you today. And
Thank
I think what I've learned is that medical writing is a happy profession. That is what I take home.
you.
And medical
It is.
writing helps us, yes, it helps us communicate with each other and helps us take the message of science to a wider audience, to the entire world, actually. दिस इज पार्ट ऑफ व्हाट वी डू एट केके मेड टॉक्स. हम यही करते हैं केके मेड टॉक्स पे. मैं आपके साथ होता हूँ हर सोमवार और हर जुमेरात, एवरी मंडे एंड एवरी थर्सडे. सोमवार को हमारा मेड टॉक्स चलता है जिसमें हम कोई भी टॉपिक लेते हैं हेल्थ का, सो पीपल आर अवेयर ऑफ दैट. एंड वीरवार को या जुमेरात को हम कोशिश करते हैं बात करने की फार्मा टॉक्स की, वेयर वी स्पीक विद लीडर्स फ्रॉम द इंडस्ट्री लाइक डॉक्टर खेर. We are grateful, Dr. Kher, for your time. We value your experience, your expertise, and we thank you for being with us. We look forward to
Thank
meeting
you.
you again, sir. Jai Hind.
Thank you.